Hello everyone. My name is Celine, and I'm going to be talking to you about my interview that I had with my mentor. My mentor's name is Annette, and she currently works at the St. Mary's Hospital in the inpatient rehab. She's actually been working there for the past 8 years, and she is certified stroke rehab specialist. I was curious about her everyday work life and what a typical day looks like for her. And what she expressed to me is that she usually works 9 to 10 hour shifts 4 days a week. And she usually sees between 4 to 6 patients a day for about 60 to 90 minutes a session. I also asked her about the types of injuries that her patients have, and she expressed that they are usually individuals who have suffered from things like a stroke or heart injuries or hip and knee surgeries, so things like that. And usually her patients are adults, so usually are individuals who are over the age of 50 years old. She sometimes will see people that are 18 to 40 years old, and very occasionally she will see teenagers. And she said usually if she sees teenagers, it's usually people that have unfortunately been in a car accident and things like that. She expressed to me that in her setting, patients typically have to tolerate about 3 hours of therapy for 5 days a week, which she admitted that can be a lot for some people. And in the event that it is a lot for that patient to handle, she ends up sending them to a skilled nursing facility so they can get care through that means. I was curious about her discharge process and how that all works. And what she expressed to me is that when she discharges a patient, she typically works with herself, the physical therapist, a nurse, a speech therapist, and a doctor as well, and they all have like a little meeting where they discuss the functionality of their patient, and they ultimately set a discharge date. And she said that date doesn't have to be set in stone, that depending on where the patient is, they can move that date. But what I really liked about this, and that it brought me a lot of comfort in knowing, is that for her setting, you discuss the discharge date with other people, other medical professionals, so it's not just you alone deciding that date. And what I liked about Annette is that she likes to ask her patient how they feel. For example, she'll ask them like, hey, how are you feeling? Like, do you feel like you'll be ready to go home at this day, or do you feel like you need to stay? And she usually keeps what they have to say in the back of her head as like a little note, and just kind of incorporates it in the discharge process if she can. And I just really like that because it allows you to be more client-centered and just kind of take their thoughts and emotions into consideration when it comes to discharge. Let's see. We also talked about burnout. And what she brought up to me that I thought was really important is that this job not only takes a physical toll on you, but it's also emotionally and mentally demanding from you, which are things that I hadn't really typically considered. So she said to just a helpful reminder is to take care of yourself before you are able to properly take care of others. And then we ended up sharing like a bunch of stories, patient stories back and forth. I was fortunate to have worked as a CNA, and so I shared some of my patient stories with her, and she shared obviously her patient stories with her working as an OT. And one story that I thought was particularly interesting was this patient who she saw, who he was from the country Georgia, and so his English unfortunately was not very well. So he was a food truck driver, and unfortunately he got into an accident and got injured, and so that is why he had to receive care. And they do have an interpreter at their location. However, she was not very familiar with his language, and so they weren't able to communicate with him as well as they would have liked. And so Annette admitted to me that Colleagues were a little frustrated with him because they weren't able to communicate as well, and they kind of deemed him as like difficult to work with. And so Annette, when she first went into meeting him, she kind of admitted that she had her walls up because her other colleagues had said he was difficult to work with. But what I really liked about her that I think is quite admirable is that she actually looked up how to say hello and thank you in his language. And so prior to meeting him, and so when she went into the room, she said hello, and that she said that his face like instantly lit up, and that built their rapport, and she was able to connect him on that way. And he then from that point seemed more interested in his care, and she said that she felt like she could relate to him and be there for him. So I really like that, especially because OT as a profession is so very diverse, and I really just like that she took into consideration his thoughts and emotions and like incorporated that in her care. Overall, I really enjoyed her as a mentor. She taught me a lot, and I'm just very grateful to have her. And I hope I get to speak with her more beyond this assignment. But thank you for watching, and have a great rest of your day.